Welcome back to Mayo Clinic Radio. I'm Dr. Elizabeth Cozine.
And I'm Tracy McCrae.
When it comes to birth control, there are many options. From natural family planning and over-the-counter birth control products to prescription contraceptives, and now there's an app for that.
There's an app for everything.
I know.
Of course, there has to be.
There is. The Food and Drug Administration recently approved a Swedish app called Natural Cycles to market itself as a form of birth control in the U.S.
This is modern technology's answer to the age-old method of women keeping track of their cycle to determine a fertility window, either to become pregnant or to avoid conceiving. And here to discuss is Mayo Clinic gynecologist and fertility expert, Dr. Margaret Long. Welcome back to the program, Dr. Long. It's nice to see you again.
Thank you.
Now, the old joke that I remember is people who use, you know what they call people who use the family planning method? Parents.
Yes,
right.
Yes.
So I'm not sure that I want to put my fertility, if you don't want to have babies, in the form of an app, in the hands of an app.
Yeah. So I think it's a good method of avoiding pregnancy. It requires a lot of personal input and dedication to do natural family planning. And it definitely reduces the pregnancy rate, but it may not reduce it enough for certain circumstances. That, if you really, really, really don't want to be pregnant right now, this may not be the way to go. It involves checking your temperature every morning. You have to have a regular sleep schedule. You can't exercise vigorously the night before. I mean, there's a list of about 8 different things that you have to do to make this work.
So instead of keeping track of it on a piece of paper or in your diary, you put it on an app. That's kind of the
basically.
difference.
And I think it does provide a little bit of decision support, so you don't necessarily have to keep track of certain parts of the decision making, but you still have to input data on a regular basis. Actually, the big study that they did to support approval of this app, only about 45% of women were still using it after a year.
Because it was too difficult?
I guess so. I mean,
So, do you know where this fits in with, like, on social media feeds, you'll see a bracelet to monitor your fertility or things like that. Do you have any idea about any of those?
I don't know about the
Okay.
bracelet. There are some things that do help you keep track of what days of your cycle you're in. And, for somebody that has a totally, utterly regular, normal cycle, that's fine. Most women don't. Most women fluctuate a few days here or there. That's totally normal, but it does make it more complicated to do it that way.
Well, let's talk about the pros and cons of the different methods. So what are the pros of a natural family planning or using this app, for instance?
There's no hormones involved. Some women either have limitations to what hormones they can use or choose not to use them. There are beliefs, that they shouldn't use hormones. This can support women that are, trying to use a totally hormone-free method. You can start and stop it whenever you want. You can go online and start it up. And they'll let you start it whenever.
So who do you think would be the ideal candidate for using this app? You mentioned the regular periods.
Yeah, so if you don't have regular periods, it's not going to give you very many days where you can have unprotected intercourse. Okay. The average age of women that were using it in the study was about 30. You're not supposed to be under 18, and actually younger women tend to have more irregular periods, and also their fertility is really, really good. Yeah. So probably not good there. Perimenopausal women don't qualify. So kind of middle-aged women with regular schedules and a commitment to using this. That
would be a good candidate.
Right.
What sort of birth control would you recommend for the women that aren't really a candidate for this app?
There are a lot more options for birth control out now than there used to be. The very highly effective methods, which are sometimes called LARC, have pregnancy rates of a few per thousand per year. And, that's similar to having your tubes tied, except for it's reversible. And so, if you're in a position where you really, really don't want to get pregnant, one of those options probably would be a good choice. There are benefits of hormonal contraceptives such as birth control pills as far as cycle regulation. For some women, they can help with acne. There are other things that you get out of birth control other than contraception. And so, that would be a reason why you might choose some of those.
What about IUDs?
that would be one of the long-acting reversible contraceptives.
Which is
or-
LARC, which sounds really happy.
Yeah.
Gotcha.
Yeah.
And also over-the-counter options like condoms.
And I mean, the condoms are tons better than doing nothing, but they don't work as well as hormonal contraception. And I think of it as hormonal contraception usually works in multiple different ways, whereas barrier methods work in one way.
Very good.
And if the one way doesn't work, then
You might have a baby.
There's no backup.
Right.
What about side effects of like if you're on the pill or IUD that might make it more difficult to get pregnant in the future? Is that of concern for some women?
The hormonal contraceptives work while you're using them, but they don't affect your future fertility. One thing that does really hit your future fertility is time.
That's a tricky one.
And
more
by
women,
time, do you mean age?
Yes,
Yeah.
yes. So that your fertility now is better than what it's going to be in 5 years or 10 years or 15 years.
which is tricky because many women are waiting longer to have
Right.
their children, to start their family.
Right. And I mean, fertility gets a lot worse in the late 30s, but when fertility drops off varies tremendously from individual to individual.
Well, we wanted to get you in here to talk about this Swedish app as a form of birth control, but now that you're here, let's talk about the Mayo Clinic app.
Right.
Because you played a little bit of a part in that.
Right.
And I recommend this all the time. I love it for my patients.
So it helps you decide what's the right sort of contraception for you. As you know, we mentioned earlier, there are a lot of factors that can go into what's the right contraception for you right now, because it may be that there's one option that's the right thing now, but in a couple of years from now, something else might be a better choice for you. So, the answer can change over time, but this kind of helps you figure out, looking at your medical history and how much you're interested in being pregnant or not being pregnant, and, are you a good pill taker? Some people are, some people definitely are not.
One thing I really like about the app, it also shows little pictures. So there's some visuals. You can say, oh, this is what an IUD looks like. And it helps the patient really imagine where it might go, what it might do. And sometimes that can be a little more tricky than you think. And so it's helpful to separate out a pill versus, the LARC option.
Right.
Gotcha. And how can people find this app? What's it called?
I think it's the Mayo Clinic Birth Control.
Yeah, let's ask the doctor who refers it.
I recommend it all the time. So I tell my patients, just go to any app store. You can get it on Google Play or on the Apple App Store. And so if you just search Mayo Clinic, it usually will come up. And it's called the Mayo Clinic Birth Control app. And last I checked, it was not free, but it was a really nominal charge. I think maybe $2 or $3. I'd have to confirm that. But a really good price to help you make an informed decision. And sometimes that office visit isn't just quite enough time to have people really digest what it is they might want to use.
Right.
Excellent. Well, we've been talking about birth control options, including an app that was recently approved by the FDA with Mayo Clinic gynecologist, Dr. Margaret Long. Thank you for joining us, Dr. Long.
Thank you.